Roche reveals that TECENTRIQ in combination with Celgene's Abraxane improves progression-free survival in patients with frontline metastatic triple-negative breast cancer. Full clinical data from the Phase 3 IMpassion 130 study will be released at an upcoming medical conference, including the progression-free survival data itself. Positive results in patients with frontline metastatic breast cancer are a bonus to the positive data that was released last week in patients with frontline small cell lung cancer. When meeting the primary endpoint in the Phase 3 IMpassion 130 study, Roche intends to file for regulatory approval of TECENTRIQ both in the United States and in Europe. The improved progression-free survival endpoint being met for the IMpassion 130 study will help frontline metastatic triple-negative breast cancer, especially since it still remains as an unmet medical need. Recently, Roche TECENTRIQ announced that a combination treatment with TECENTRIQ was able to meet the primary endpoint of the study in patients with frontline metastatic triple-negative breast cancer. This new data by the company is another frontline win in a different form of cancer. That's because last week news broke that a TECENTRIQ combo was also successful in frontline small cell lung cancer. It seems that TECENTRIQ has finally found its footing in the cancer immunotherapy space. For that reason, I believe that Roche is a buy. Trial news: the positive news for TECENTRIQ stemmed from the Phase 3 IMpassion 130 study. This study recruited 902 patients with frontline metastatic triple-negative breast cancer (mTNBC). Frontline meaning that these patients had not received any prior systemic therapy for metastatic breast cancer. Patients were either given the combination of TECENTRIQ and Abraxane, nab-paclitaxel, or placebo with Abraxane. The primary endpoint of the study was progression-free survival (PFS), which the company announced was met. In other words, the combination of TECENTRIQ and Abraxane reduced the risk of disease worsening or death compared to the placebo combination in this patient population. One quick thing to note is that Abraxane is a cancer drug that was developed by Celgene, Celg. No detailed results have been revealed. It is anticipated that Roche will reveal the full data set from this study at an upcoming medical meeting. It is a good thing that the primary endpoint for this study was met. However, there are two other important items to know about this latest piece of news from the IMpassion 130 study. The first is that these patients with metastatic triple-negative breast cancer have limited treatment options. The second is that this is the first positive immunotherapy late-stage study in patients with triple-negative breast cancer. Even though the data has yet to be revealed, Roche is pressing on filing for regulatory approval of this TECENTRIQ combination in mTNBC. It will file for regulatory approval to both the FDA and the EMA. Prior win in lung cancer with TECENTRIQ. The latest trial win in frontline mTNBC only adds more fuel to the fire for TECENTRIQ in being successful. That's because about a week ago, Roche revealed a major win in treating frontline small cell lung cancer (SCLC) patients with another TECENTRIQ combo. This involved the combination of TECENTRIQ and chemotherapy, carboplatin and etoposide. It was noted that the TECENTRIQ combo was able to improve patients with respect to overall survival and progression-free survival. Both of these measures were the co-primary endpoints of this study. If TECENTRIQ makes it out as the clear winner, above other immunotherapy combinations for this indication, then it stands to make $1.5 billion in sales as a first-mover advantage in the frontline SCLC space. Conclusion: Roche has been able to achieve another win for a frontline cancer treatment with a TECENTRIQ combination. This is especially good, considering the fact that there are still limited treatment options for patients with mTNBC. It is still no clear sailing though with respect to regulatory approval. Roche stated that it will apply for regulatory approval for TECENTRIQ in the frontline mTNBC population. That doesn't mean that the FDA and EMA will both approve the TECENTRIQ combination for this indication, and that still remains a major risk. Another risk would be that Roche isn't the only game in town for an immunotherapy in this setting. That's because Merck (MRK) is testing Keytruda in combination with chemotherapy for patients with locally recurrent inoperable or metastatic triple-negative breast cancer. This study for the Keytruda combo is known as Keynote 355. The good news is that data from this late-stage study is not expected to be released until 2020. That means Roche has the first-mover advantage in this space. For that reason I believe that Roche is a buy. Disclosure: we have no positions in any stocks mentioned, and no plans to initiate any positions within the next 72 hours. I wrote this article myself, and it expresses my own opinions. I am not receiving compensation for it, other than from Seeking Alpha. I have no business relationship with any company whose stock is mentioned in this article. Editor's note: this article discusses one or more securities that do not trade on a major U.S. exchange. Please be aware of the risks associated with these stocks.